Right. Hello, can anyone hear me? Okay, looks like it's working now. So hi, my name is Nehal Desai. Um, so I understand some of you might have some questions, as to how to prepare for the NABP NAPLEX board exam. So I posted this um, outline a while back, and it's basically coming right off of the NABP webpage. And there's some things on here that I haven't really fully covered in our NAPLEX review course, but we will be covering those topics in our future presentations. Um, what I wanted to do was basically do a quick review over this outline, just so you're aware of the types of things to look out for. Um, but before we start, does anyone have any questions? Um, there is this chat bar here you guys can use to type your um, questions or comments here. So, um, and like I'll be posting some additional information. Some of you, I don't know if you have visited our Facebook page. Um, there's some information on there as well. Um, Sorry, I'm just having a little bit of trouble here. But yeah, so let's just quickly take a look at this. As shown here, the slide set is information from there is posted on the NABP website. It is, it kind of breaks down everything that you should know before the exam. Um, just use as a reference this YouTube channel as well as any other information that I post or any was posted from our farm science and farm bits team is going to definitely become very relevant in terms of preparation for the exam. Um, Definitely want to look at the different domains. The domain one is definitely the foundational knowledge for pharmacy practice, and really just want to make sure that you have an idea as to mechanism of action of many of the medications. I have posted quite a few on there, and you guys can go through and navigate through the playlist. Um, there are also some concepts posted on pharmacokinetics, dynamics, and genomics as well. Some of the pharmaceutics as well. So you could see all of that in there. But I highly recommend you guys go over the information in your study material as well. Um, but as I mentioned earlier, the topics on these videos are definitely going to help um, in as a supplement to studying um, and focusing for the exam. So, just be aware that these tools are available for you to use. Non-sterile preparations, definitely understanding the differences there, especially when it comes to sterile preparations. There's a lot more involved. Um, and also hazardous, some hazardous drugs, knowing the USP 797, 795. 800 as well. Also the um, NIOSH drugs as well. It's important to at least have a basic understanding of all of that. Also, the materials. What materials do you use when compounding? What kind of equipment is needed? Knowing all of those equipments, and also understanding like some of the calculations associated with that compounding um, preparation. So take a look at all of that, um, because there's going to be quite a bit of questions on the exam on that as well. So understand these different preparations, compounds, excipients. Definitely look at all those excipients because that's part of the preparation as well. So, you know, in the HLP and all of that. So definitely look at all of that, um, because any of that is fair game for the exam. The next thing you should be looking at is definitely the calculation portion. Know the calculations really well. There's a whole video series already posted on FarmBits that will go over is the basic equations you should know for the exam and some practice questions. Keep using those practice questions as a study guide. Study those practice questions, understand how to answer each and every calculation question. If you cannot understand it further, you can just reach out to any of us, or you can use your books or any other study tools to make sure you strengthen your um, knowledge on this, and having a good foundation in terms of the pharmacy practice section in this domain. So um, understanding dose conversions, drug concentration, ratio constraints, osmolarity. You have to know those kinds of equations that you use. How would I convert this percent? How much percent of this medication is needed, or how much of this, what is the allocation? Knowing all of that. Dose conversions, converting milliliters to liters to grams, and doing those kind of conversion practices as well. Quantities of drugs or ingredients to be compounded. Going back to compounding, understanding those quantities. Um, so that's very important. Sometimes doctors write a prescription, they don't display the quantity of the medication. You have to figure that out, and it's quantity sufficient. So you have to see how much of it you need to in compounding or in dispensing medications too. So you have to do a little bit of calculations there. Sometimes you might need to you do a calculation from one antibiotic solution to another. Um, See how much of uh, that other antibiotic is needed. Um, Also, nutritional needs, proteins, dextrose, and the lipids, doing those different nutritional TPNs and all of that is important. Um, Rates of administration, um, how much of that IV fluid should be given to a patient, is it 20 milliliters per hour, 30 milliliters per hour? How much of it is the patient supposed to be getting when they're on IV and in a hospital or clinical setting? So just understand all of that. Patient parameters and laboratory measures, definitely taking a look at those labs, understanding the potassium value and how much potassium is needed. It does it fit within the range, normal range, does sodium normal, checking all of that. Pharmacokinetic parameters, pharmacokinetics, again, very important, understanding, the bioavailability of drug or how much half-life is needed or for it to be fully eliminated or and things like that. So understand all of that. Some of the epidemiological and pharmacoeconomic measures are important as well, and biostatistic portions of it. So I'll be adding more questions on that as we move through these presentations. But these are good different things that you should look out for when you're looking over this outline. Um, Drug development processes, clinical trial phases, emergency use authorization. So you have to understand different types of clinical trial phases: phase one, phase two, phase three, emergency use. All of that part of the drug development process. So, and also research design principles and biostatistics. They already listed like blinding, randomization, biases, statistical tests, and outcomes, and ethics. All of those types of things when you're looking at a case study, for example, um, and just using clinical judgment as to what the final outcome will be, or what type of research is it, or knowing all of that. Is it a um, is it one of those where you have to look into the um, guidelines, or is it one of those where you have to actually look up the measures? So understand those kinds of things in statistical tests use, like the chi-square test, for example, the confidence intervals, um, all of that. So it's very important to at least have that kind of understanding, primary, secondary, tertiary literature sources as well, and knowing which ones are necessary. All right, let me see what's going on here. Okay. Then we come into domain two, which is medication use processes: prescribing, transcribing, documenting, dispensing, administering, monitoring. All of that is important. Um, is a doctor prescribing? Um, is it the correct doctor prescribing for this medication? Like, should a nurse practitioner be allowed to prescribe, certain controls, or is, looking at all of that too sometimes is important, but that's more focused into the law section of it. However, in the NAPLEX, they might have a question or two um, very closely related to the situation where a prescriber is allowed to prescribe certain type of medications. Um, and it's common sense type, like, if eye doctor's prescribing, should an eye doctor be prescribing something for a pain medicine or something like that, or like a skin medicine, so just at least having a common sense knowledge on the prescribing, transcribing, and documenting, um, dispensing, prior to dispensing, always want to make sure that you're looking at the DURs to see if the patient is okay to take a medication. Um, you know, if it has, even if it has interaction with another medication he's on, or at least look at those types of things. Um, Counseling patient on medication prior to dispensing, especially when they have allergy to a medication that's uh, in the same class or in a similar category as the medication the patient's taking. You want to be very careful with that. If they have allergy to a medication, unless they have had it in the past, um, it's you should definitely make sure that even if they have had it in the past, they might not have had allergy back then, but now they have allergy. You want to look at those things and see is if the patient, if there's going to be any major risk in taking that medication or not. So all of that. So those factors are very important. dispensing, um, uh, administering as well, and monitoring. So these are the things that we have kind of looked at in our top 200 drug list. You can refer to those presentations in our Farm Bits playlist. But just definitely understanding the drug name, the therapeutic classes, indication, usage, dosage regimens. That's all very basic information, and I think that will be very vital information throughout the whole exam. And you should at least have someone for understanding of the drug names and the classes. At least having that, you guys should be able to do okay. But knowing what am I taking, what am I taking this medication to use, and how should I be using it, and what is the and dosing, regimen on it. Is it a pill? Is it IV? Available dosage forms. You have to know, at least somewhat have a basic understanding of some kind of dosage forms, like ondansetron. Ondansetron comes as solution. Ondansetron comes as um, uh, you know, pill form, but sometimes it could be used in IV. And you have to understand like these different types of dosage forms to have an idea, how a patient can take it. Um, the patient might not be able to take the tablet and they can only take the sublingual form, then you have to give that on the in the sublingual form. So things like that. So understand what available dosage forms are available and in what setting. Um, Also, one other thing is understanding the boxed warnings. Certain medications have boxed warnings, like you can see like something like um, RAMS drugs and things like that. So kind of look at all of that. Laboratory parameters, vital signs, um, potassium, sodium, chloride, all of those safety and effectiveness. And then therapeutic substitutions. We'll look at all of these in the next sections. Thank you for watching.